this year we're presenting a breast expansion cohort of our ETCTN trial 9844, Entinostat, Nivolumab, and Ipilimumab in advanced HER2-negative breast cancers. This is a trial that was designed as a phase 1 trial to test the safety and novel combination in patients with advanced solid tumors. And our recent publication of these results report that this treatment combination is associated with expected adverse events for these agents, and recommended phase 2 dose was identified with an overall response rate of 16%. And that included observed responses in patients with a triple-negative breast cancer patient, as well as hormone receptor positive. So, and the correlative studies from that publication show an increase in CD8 to Treg ratio after combination therapy. So I'm going to be, at ESMO, I'm presenting the initial results from our planned expansion cohort in patients with HER2-negative breast cancer. So in the expansion cohort, we have patients were treated with the recommended phase 2 dose, which included a 5 milligram weekly Entinostat for 2 weeks, and then the addition of 3 milligrams per kilogram of Nivolumab every 2 weeks and 1 milligram per kilogram of Ipilimumab every 6 weeks. And then we had blood and tissue biopsies at 3 different time points after the Entinostat run-in, and then after the 2 week. It was blood and tissue biopsies collected prior to the onset of treatment, after the 2-week run-in with Entinostat, and then 8 weeks after the addition of the Nivolumab and Ipilimumab. And so we have 18 patients from the dose expansion cohort that we are presenting on, in addition to 6 patients who have breast cancer from the dose escalation cohort who received the combination of Entinostat plus Nivo and Ipi. So that's a total of 24 patients that have breast cancer, divided actually 12 and 12 triple-negative breast cancer patients and 12 hormone receptor positive breast cancer patients. And these are all patients with advanced cancer with a median of 6.5 prior therapies. So the results that we're going to be showing include that the objective response rate in this cohort was 30%, with response observed in both hormone receptor positive and triple-negative subtypes. The majority of these responses occurred in patients with triple-negative breast cancer that we're going to show in the graphs. And one patient actually had a complete response at the 6-month time point. And then duration of response ranged from less than 2 months to the longest response actually ongoing at greater than 24 months after initiation of treatment. And then the median progression-free survival for the overall cohort was short at 2.5 months. And median overall survival was 7.7 months in all patients, 24.4 months in patients with triple-negative breast cancer, and 5.9 in those with hormone receptor positive disease. And of note, those that were driving improved overall survival are the patients who experienced response. And then we also discussed possible immune-related adverse events that are similar to those reported in the dose escalation cohort. We had only 2 patients with higher grade AEs, a grade 4 increase in lipase and grade 5 respiratory failure, but both presumed to be not immune-related. And then we are going to show a brief introduction to some of the correlative studies that are ongoing. We show the investigation of T cells that demonstrates a ratio of CD8 to FOXP3 T regulatory cells increasing after therapy. So it's the baseline time point compared to time point 1 and time point 2, you see a really nice increase in particularly your CD8 cells, but the whole ratio goes up. And this is most obvious in the triple-negative cohort. We also discussed results about tumor infiltrating lymphocytes, and there didn't seem to be an obvious trend in the abundance of what's called TIL across the breast cancer subtypes or with treatment. So it's not likely that the TIL is going to be a reliable biomarker in this setting, but certainly the CD8 and FOXP3 ratio results are very nice and very informative. So overall, the combination of Entinostat, Nivolumab, and Ipilimumab at the recommended phase 2 dose was associated with expected immune-related adverse events in an advanced HER2-negative breast cancer cohort, and an objective response rate of 30% suggests further evaluation is warranted. And correlative results suggest an increase in CD8 to FOXP3 ratio after treatment is also a promising biomarker.